Well, there's a lot of stakeholders in this, right?
Yeah.
You're trying to update the family. You've got to update doctors. You've got to update the therapist, everybody that's involved in a patient's case. It's not easy to do. What were some of the opportunities that you saw as an administrator or that you see now relative to just keeping everybody on the same page?
Well, during COVID, a lot of the appointments got canceled for people.
Okay.
And so they didn't get to see physicians would come into the facility, so we would still continue that. But a lot of the times if they had outside appointments, those got canceled. So they would get pushed off and pushed off and pushed off. So some
they
people
weren't getting the normal treatment that they should be getting.
Yeah.
Right.
And of course, if it was an emergency, they would get that treatment, and we wouldn't prolong treatment by any means. But if it was something that was elective, we were able to kind of push that off if we could. But there was an opportunity for facilities to really utilize something like this to update physicians, even if they couldn't see them.
Yeah.
Because it got to a point where people were pushing off appointments and they wouldn't see them for a whole year. And so then the next time they go back to the doctor, tons of their medications have changed, or any of, some of the bigger things, like maybe they declined a little bit and now they're in a wheelchair, or they need to use a walker, things like that. And that other physician wasn't notified of that. And so it just kind of makes the next doctor's appointment for that patient a little bit more difficult, because they have to then relearn everything that had happened with them in the last year.
Yeah, and you say that, and I probably shouldn't be shocked, but I still am, right? When you say a lot's changed in a year with that particular patient. But I was talking to a doctor not long ago that said that during the pandemic, this was a heart surgeon, and he said, hey, during the pandemic, patients were canceling their own surgeries because they didn't want to come into a hospital because they were more afraid of COVID than they were having the heart surgery. Doctor's response was, hey, you're on a collision course with a heart attack. Patient says, that's okay, I don't want to get COVID. And they chose not to come in for their heart surgery. So, still, when you say that a lot can happen between those appointments, and sometimes it's been a year, I probably shouldn't be surprised, but I still am. It's shocking to think that these things have been extended out, and what the potential cost or the ramification of that is.
Right.
And we're talking about time, treatment, but then we're missing on so much communication, right?
Right.
Yeah, that's unbelievable.